Rheumatoid arthritis is a disease that affects about 2 to 2.5 million Americans. It's the second most common type of arthritis. It is the first, though, that we think of when we think of inflammatory arthritis. And inflammation, of course, has several characteristics. If it's red, it's hot, it's swollen and painful, then it's probably inflamed. And if that inflammation is in a joint, then it's an inflammatory type of arthritis. Rheumatoid arthritis is the most common inflammatory type of arthritis.
The prevalence of it increases with age until you get into the mid-70s. It is much more common in women than men. It occurs probably 3 to 4 times more often in females than it does in males.
I wish I knew. If we knew the cause of rheumatoid arthritis, we could probably cure it, but right now we don't. But we're getting closer.
We know that there's a strong hereditary predisposition to the disease. There are certain markers on the HLA part of the chromosome that occur with a much higher frequency in patients with rheumatoid arthritis. The main marker for rheumatoid arthritis is HLA-DR4. There are others being identified. There are combinations of markers that seem to really greatly increase your risk of developing rheumatoid arthritis, but it doesn't look like just having those markers is the whole story. We think that you probably have to come in contact with something in the environment that stimulates your immune system, and then because you're genetically predisposed, you get this aberrant immune response that turns on your body and causes the disease.
Well, really the hallmark symptoms are it is bilaterally symmetrical, meaning it's on both sides of the body, usually in the small joints, of the hands, particularly the metacarpal phalangeal joints, which are just the first knuckles, often the middle knuckles as well, and the wrist, what we consider the carpal joints, which are the back of the hand or the wrist. Those are commonly involved on both sides of the body, and of course in the feet it would be the base of the toes.
Other types of inflammatory arthritis might involve only maybe one knee and an ankle on the other side of the body. This will usually involve the wrists, the knuckles in the hands, the knees, the ankles, and all the joints in the toes. And it will usually involve the same joints on both sides of the body. The patients are usually extremely stiff in the morning. Typically you'll get stiffness for more than an hour, so it takes them more than an hour to get going in the morning. And when you look at the patient, you'll see the swelling, you'll feel this kind of boggy, squishy feeling to the joints. Sometimes the joints will be red and warm to the touch.